Hello, everybody. Welcome back to Medical Monday. We're going to be talking about thumb pain.
Thumb pain.
So just, from thumb wrestling, from other injuries.
Yes.
Your thumb's a little bit different in your hand. It is actually about 11.3% of all ER visits because of thumb injuries. Your thumb itself is separated from your fingers, that allows for it to move, flex, and extend more than a normal finger.
Yes, flex and extend.
All along with it rotates.
Opposition.
Yep.
That is the only joint in the body that opposes.
Another one. That's how we can grab things. That's what makes us different.
Yes, it does. It does. We are the only species, essentially, that can do this.
So we can pick things up and do what we need to do. But because of our thumb, the abilities that we have from it, it moves much more than a normal joint. All right.
Yes.
Most of your fingers, all your fingers actually have 3 bones, but your thumb actually just has 2. All right. And it actually moves by 9 different muscles. 9 different muscles move your thumb in all the different directions that it does, which is a significant amount of muscles, but then also a significant amount of options to have tendinitis. Tendinitis is what connects the muscle to the bone so that it moves it, but with overuse, that tendon become inflamed, tender, and painful.
Yes, they do. So with 9 muscles, if you do the math real quick, there's 2 ends to a muscle, right?
Yes.
That's 18 different options to get inflamed, irritated, and make life difficult. So if you've ever tried to open a pickle jar, or if you're my daughter, pickled okra jar, it hurts.
It's a Louisiana thing, pickled okra. Not necessarily. I like it too. But because of the thumb, the way it rotates, it actually has a pretty good joint space.
Yes.
With movement of joints, it keeps them healthy. So the main problems that we do have with thumb pain, we see these ER visits, are cuts. Cuts are, part of life. Things happen. What you want to make sure of, if you are to cut your thumb and you think you need to go to the emergency room or somewhere to get it sewn up, is make sure there's no ligaments, tendons, anything you can see in there. If it's really deep. Otherwise, if it's superficial, means very small, just make sure it's very clean, because you're going to use it and it'll keep reopening that area. So we always want to clean it very well so that it doesn't become infected.
Yes. And that is a very important factor, because we have different type of skin on our palms of our hand than the rest of our body, and it sweats more. So with that, when we have a cut that's too deep, our hand sweats, so you do need to clean it more often, more frequently, and make sure that it keeps dry in the aspect to allow it to not get infected. So that's a very important thing.
Besides cuts on our hand or our thumb, what we see is deformities, and those are from breaks. A fracture of the thumb is actually not very common. We don't see those very much because they're more common in crush injuries. If you crush it, get it in between, caught in between 2 different objects, that's where we see most breaks. We don't actually see them with, blunt force trauma or a hard physical, like we step down and we break your ankle. It's not like that. The thumb, actually, most of your breaks come from a crush.
Yes. And then also what can happen in regards, not so much to crush injuries, but injuries in general to the hand, increase range of motion, right? We can have 10 to 15% increase in range of motion if there's a certain type of sprain or strain to the ligaments or structures in the hand. So we have to be careful and cautious when that's the case. Sometimes it's exciting when can we move farther than we're supposed to, but it's usually not a good thing.
Definitely so. And the Department of Hand Surgery in London noted that you have this increased ability to move your thumb. It's just a simple strain.
I think it's because of the T.
It's because of the T. Maybe.
I just thought I would.
But you also look at skier's thumb. Skier's thumb is not very common, but it is a gripping motion, and you get it with bats, you get it with skis.
I forgot my bat. I'd swing it.
And that actually causes pain within people's thumb just because of the amount of force, and it decreases their grip strength. So like Dr. Gabby was talking about, opening a pickle jar or a doorknob, that's very, very painful.
Yes, absolutely.
Those are more your less common things that we see with the thumb, but the things we see here a lot of, or patients have concerns, is arthritis. Arthritis within that joint. It's actually called your CMC joint at the base of your thumb, and it's the most used joint within the body. So with arthritis, you have the inflammation of the bone. It's very tender. It's very painful. Even just throughout this whole area, you can have some tenderness. And it actually will have a deformity as far as the base of your thumb will get very large. Enlarged, it's because of the swelling of the bone, the arthritis. And it's very tender.
Very tender.
Hard for patients, if they're a mechanic, for them to do small movements to get what they need, or if it's a crafter to try and craft something. It's very difficult and painful for them to continue on with their activities.
Yes. one of the big things that you'll notice is with handshakes, because a lot of times you move and use your thumb, just the tenderness from doing a handshake will be tender. Because when I work on thumbs, whew, if you haven't woken up yet, you'll definitely wake up from just some tissue work in there. So it's very true.
But if you have this thumb pain, if you have this arthritis that you know you're going down that path, there's actually a few things that you can do at home. First and foremost, what we want to do is we want to rest. We want to get away from those activities that are causing this discomfort. And that's counterintuitive from what we're always saying. We want to keep patients active, and if you enjoy crafting, that's what we want to do, is keep you crafting. However, sometimes you just need to take a little break. Not saying you're going to stop crafting forever, but you want to let that joint space calm down and heal a little bit. Okay.
And the rest, in conjunction with other therapies at home, is great. When you rest it and then also support it through other therapies, you get more and more benefit from the rest instead of just resting. Because if you rest it and don't do anything else to support it, it might still be irritated by the end of that rest period. So icing it is another phenomenal therapy to actually help reduce the inflammation and allow you to get that movement back, and also get you some relief regarding pain. You could just use a generic ice pack. I know we like bags of peas, frozen bags of peas. You even have a little snack while you're
2 in 1.
Yes.
But when she talks about a snack, we also want to be mindful of our diet.
Yes.
So our diet can cause inflammation within our joints because of the things that we eat. So if we did an anti-inflammatory diet, we can get rid of some of that inflammation naturally.
And that is actually something that we help work with patients on here in the office in regards to low inflammatory diets. So that's a great thing.
But other than your diet, you can do at home that Dr. Gabby talked about, your urgent care, you can go to your primary, whoever, that would also be able to help you, assist you get some of this inflammation gone by giving you medication. There's anti-inflammatory medications. There's a slew of them out there. We can get some of them over the counter, like Motrin, Aleve, Excedrin, but then of course there's prescription ones that they can prescribe. They're a little bit safer on the side effects, but they're still a medication. So if you don't want to go down that route, there's the things you do at home, but then there's also a few things that you can do more naturally.
Yes.
And one of the things in particular that we do here is the nutrition within that joint space through platelet-rich plasma.
PRP.
Yep.
Yes.
That's your own blood. You concentrate your own blood, just the growth factors to put in there so that it can help get rid of this inflammation and also put some good nutrition into that joint space. What happens is the joint space, because of the inflammation and because of the change within it, it stops moving fully. When it stops moving fully, the fluid, the nutritious fluid in there no longer is nutritious. It deteriorates over time, and what we want to do is boost that nutrition so that you can actually heal that joint space itself naturally, just directly into there.
Yep. And then also through that process, you mentioned lack of movement. We have 9 muscles that help move the thumb. We need to get movement in those muscles so that we can get the movement in the joint space. So as we go through that process, we do the PRP. Sometimes we don't, but it does help to get movement in there. And that's where adjusting that joint helps phenomenally, as well as the percussion point therapy to increase blood flow to the tissues to allow for increased movement and increased use. So to break up scar tissue, to get movement in there, get some discomfort removed as well in regards to just filtering through what's going on in those muscles.
And a lot of these thumb pain that you see it didn't happen yesterday. It is a long process, and it takes time for that joint space for patients normally to realize that there's that much of a problem. By the time they get to that point, the muscles that function for that joint, they have atrophied, means that they have slowly gone away, and that's what we really need to work on to help strengthen those muscles so that as the joint space gets healthier and happier and starts moving more, those muscles have the ability to move it.
Yes, absolutely.
Yep. So the thumb itself seems pretty simple, right? We use it every day. Like I said, it's the most used joint in the body. But there's a lot of muscles, and then there's a lot of planes that it moves into. So there's a lot of options for patients to get themselves in a little bit of pain. We've went through some great home therapies. Of course, you can always go see somebody else to help with you for medications. But if there's non-medication therapies or more natural ways to do it, there's also, we talked about, great options for that.
Yes.
I hope you guys learned a lot about thumb pain, discomfort.
Yep,
we call it the CMC joint in the thumb.
Did you say TNT?
CMC.
Okay, sorry.
So I hope you learned a lot about the CMC joint, and I hope you're not having any discomfort, but I hope we've given you some good tips.
Yes.
Till next Monday.
Yes. We'll see you guys next Monday.
Bye.
Bye.
That wasn't that bad. Stop. video in the thing.